think the discussion will never have an end when there is a hot topic like this, and we will have to shift to the last lecture. Thank you very much. Thank you.
Now أنا سعيد إن أنا أقدم الدكتورة سحر البشير، الأخت والزميلة العزيزة والضيف العزيز علينا في مصر. هتتكلم على الأوكمو تريننج بروجرام in gynecological oncology from fellows point of view. اتفضلي يا دكتورة سحر، كلنا مستمعين لحضرتك وهنستمتع بيك إن شاء الله.
Thank you.
شكرا.
Thank you. Good afternoon, everyone. I'm very privileged for the nice introduction of my senior and dear friend, Professor Ala Ismail. We had spent nice days with them in the Asyut University. Welcome also Professor Sham, and congratulations for professorship. Dear speakers, it's a big honor and privilege to be here standing in front of you, telling you my story, a trainee in the OCMO. I hope that I'm a bit quick, and I know that you're tired by the end of the day.
Sahar, it's the last presentation, so you have your time, okay?
Okay.
I just assure the audience this is our last presentation for today, so Sahar will tell it. And really, Sahar, I'm going to comment after you finish, but it is our last presentation, and we will have the cadaveric videos for tomorrow with the live transmission, okay? So keep cool, it's okay.
Okay, thank you. It's not working. Okay, I'm come from this place, from Sudan. I wish to accept your prayers for us to escape the war. This is our capital city, Khartoum, from where I used to live. Now my journey starts from the University of Khartoum. This is one of the oldest universities in the region, almost 100 years back had been started. And from such a prestigious university, I start my journey into the well-known, highly reputed place, the University of Mansoura College of Medicine. I used to work also in this place. This is the tertiary Soba Hospital, the university hospital affiliated to University of Khartoum. We were pioneers in a lot of subspecialties. This is what the place first time to have renal transplant in the region, and where we had the advanced physiological neuro studies, where we used to have the first fetal medicine. But I have to admit that we're a bit late when it comes to oncology. That's why I took my journey along to the OCMO, because of its well-reputed place. This is the ESGO accredited center, the one and the only in the Middle East. Congrats for that. Why am I here?
Alexandria is too accredited, so.
Also, thank you. I missed that. So, but it is the first one.
It's the first one.
It is the first one.
Yes.
Yes. Why am I here? We have been operating for the last 4 or 5 years in our patients out of interest. Me as an obstetrician gynecologist with a special interest in oncology surgery. I had a local training, 1-year attachment with the one and the only gyne-oncology surgeon in my country, but this wasn't enough to deliver service to my patients. That's why I plan to have a certified training in gynecological oncology surgery. The other objective is to start the first women cancer center in Sudan that is to deal with both breast and gynecological tumors as well, also in the Soba Hospital. I'm also interested in community awareness, especially in cervical cancer, and I'd like to direct me and my group the decision of policy makers towards the importance of reducing mortalities due to maternal cancer and women cancer. Hence, ESGO training program was the target. This is a golden chance to attain certified training in gynecological oncology. As we all know that there are increased demands and overwhelming obstacles, especially in the low and middle income countries like ours. This will, of course, increase after the war. The Oncology Center of Mansoura University, to me, is an oasis of knowledge and experience among the whole area. Not to forget diversity, equality, inclusion of all health care providers, especially empowerment of women in this field. ESGO program, we came to know out of this 4 years back, searching the web about a suitable program for us in Sudan. The great news came that the OCMO is accredited at the ESGO Training Center, first center in the Middle East. We were happily and joyfully following the steps of Dr. Hassan and Dr. Walid when they were first chosen. This was the first batch 2 years back. And we were also following the Wednesday lectures. Now a dream is becoming true. I started this year, 2023. I'd like to thank at the start the whole team of OCMO for their warm welcomes, the cooperation and the support, and a special thanks to my mentor, Dr. Bashir, for his undeniable and patient effort to make this possible. First day in the OCMO, we presented here my dear friend, Dr. Amira. First time, Dr. Bashir took us in a elaborative tour and introduction to the working staff. Then we were followed by our great friend and supporter, Dr. Amr, thanks he's here. What requirements that need to be achieved for the ESGO program, and how does the OCMO provides this? There are theoretical part and a practical part. Well, this is the most hectic part, in my opinion. Studying all these lectures, the OCMO provides a well-elaborated curriculum for gynecology studies. The curriculum covers almost the whole subject. There are regular Wednesday lectures by highly qualified and specialized members in the field. There is a meticulous announcement every week, and punctuality is mandatory for both the lecturers and the attendees. Lectures are also registered online. You can find them on the EGO's site in YouTube and in Facebook. The modules were followed by assessment exams. We are having a one tonight.
Speaking high about the program doesn't mean that you will pass the exam.
Oh, I'm trying to bribe you all the time, and I failed.
So
sorry for that.
From the ground.
I've been trying
for
to
everyone. From the ground, for everyone who wants to see this live tonight, we are all invited here at 8:30. So we'll have our last didactic in ovarian cancer module. It's about perioperative care, advanced ovarian cancer, and following it, the exam for Amira, Sahar, and Amr. I want all of you to be supervising, okay? And who want to take the exam and to correct for himself, he will take it. And so you will see the exam, it's only 20 MCQ questions. It's not easy, okay? And if you pass 12, you are going to pass 60% to pass, okay? So wish them luck for tonight's exam. And speaking high about the mentorship and about everything doesn't mean anything it's an MCQ.
Oh, I failed to grab you so bad. Okay, this will also provide help for doctors all over the regions, because these lectures are being attended by global attendees nationally and internationally. This is an example of the announcement, the last year and this year. And also, these pictures were taken at the end of the lectures, virtual and actual. And now comes the MDT. MDT is the most, to me, valuable and well-structured activity delivered by the OCMO. Because I do still remember a saying mentioned by my mentor that it is not to incise, it's a decision rather than incision. You have to know when and how to operate and on what patients, rather than just operating on them. The MDT is the theater to take this decision. We have a valuable, well-dedicated team, specialized knowledge. I'd like also to greet one of them attending with us, Dr. Aman Hassan. Thanks for her and everyone in the team, clinical oncologist and radiologist and everyone. And a nurse is attending to take down the notes. This is every Sunday at 12 noon sharp, not a minute late. There is a display of cases, teaching, decision-making, and I shouldn't forget to mention also the BARSGO MDT, thanks to our mentor introducing us to the ESGO and letting us to present cases on and off in attending the MDT, taking the benefits of an international MDT as well. Doom is also activated in MDT, and it's sometimes being transmitted into theater. This is where I love to be. 4 operating rooms, well established, Saturday to Wednesday, 9 a.m. to indefinite, to whenever the case is finished. And the average cases per day, let me say it's 3 to 4 of very difficult, complicated cases. We have seen so many cases. We have seen for the first time, the uterine transposition carried by my mentor, splenectomies. To us obstetrician gynecologists, this is a challenge, although it's simple for surgeons, but we have to know how to do it. And other surgeries. It was only 2 days ago when we're operating with Dr. Khalid Jaballah in an exentration surgery. We had the privilege and benefits to attend surgeries for Dr. Khalid Atallah, that suddenly you become encountered having 2 inferior vena caves at the time, and to see the art of Dr. Muhammad Hamdi for doing the elaborative nerve-sparing surgeries. Then we move on to the research, clinical trials. I know that the center is participating in the Saruva trial, and we are in the center planning to gain the excellence for ovarian cancer surgery in the future. Workshops, local and virtual conferences. We were very privileged to attend in Asyut with Professor Ala and Professor Husham, Damanhur, Mansoura also in the Obs and Gynae department, Boursaid, but I missed many in Luxor, Alexandria, and Cairo. This is Asyut workshop. Thanks for the warm welcomes. We've been there spending good days in the minimal invasive surgery. Thanks for the discussions and knowledge carried out by the board, and the hospitality and the warm welcomes of our seniors. Thank you very much. Not to forget mention Damanhur and the challenging surgeries. I was very lucky there to be introduced to Professor Wahid by Dr. Basil. Thanks for that. To look and visualize the peritonectomies and the hypex, how it's being done and everything. Not to forget mentioning also Professor Rafiq in the Obs and Gynae course about minimal invasive surgery in the obstetric unit. And here the Board Said OCMU conference, an yearly conference done by the center. The next step I'd like to discuss is the social accountability of the OCMU, celebrating the Ovarian Cancer Day. The images and the pictures you see were displayed all over the social media, and everyone outside knows about you in the all world. They know about the activities you do in this center, which I'm proud to participate with. A day to remember when the blue balloons escaped the sky of Mansoura, celebrating the Ovarian Cancer Day, with the many leaflets prepared for women awareness about it. What's good? Logistics for surgery, to me, are fascinating. I'm not very well accustomed to having all these ligatures and the bipolars and everything is there. You have everything to do good surgery.
بس بتخلص يعني اللي بيخلص ما بيجيش تاني.
But still, they ask me not to use too much office rate because they are trying to keep their resources. The trained members, the nurse, the scrub nurse, the theater technicians, the structured hierarchy of administration in the center, the clinical rounds, clinics are very busy. The software system, Ibn Sina, although I feel sometimes frustrated to understand the system, but you have everything there in that system. All the documents are there. The dedication of the residents and patient care and the socialization and making friends. extraordinary operative activity you see in these pictures, the nice company, the excellent team of dedicated doctors. Whenever I call any one of them through WhatsApp messages, they immediately reply to me about any patient at any time of the day. Thank you, Amira, for delivering these pictures. Friends and good memories. I was happy to know many good and nice people of you, Dr. Dina, Dr. Raghda. Thanks for making the journey easy for me and the support of Dr. Amru. Okay, the good talk is done. Let's speak about what needs to be done.
And we ask it for this. I asked her.
Yes,
Please.
Dr. Basil
yeah.
asked me specifically to mention what needs to be done. As a team, we have to collaborate all together to put this in real. We need more hands-on. It has now been 5 months, and it's not enough for me to observe or to do assistant job. I'd like to go and deep into the work of operations. I'm looking forward to do the lymphadenectomies, the surgeries in depth,
عندنا
because
في
I
مصر
think that I'm
في
a
مصر
for that.
بيقولوا كلمه زودها لك الكلمات المصريه بتاعتك بيقول لك كلها طموحات وامال عارفه يعني لا لا
Okay, this is what I'm dreaming of. Okay, more workshops, part of the final ESGO assessment, because the more workshop you attend, you will have certificates, and this you have to locate them on the logbook. I'll let you have a look at the logbook as well. Research need to be activated more, as many as possible, because publication is a requirement to have the fellowship. You know, the program is a 2-year program. You are allowed to have the exam after the first year, 1 year in an accredited center like the OCMO here, and you are not being a member unless you pass your exam, you have a publication, and you finish your logbook with the required number of cases. Then we asked trainees, this is a challenge for Dr. Basil. We need to ensure that our logbooks and assessment formats are filled regularly